Hello, I am Dr.Ashish Dengra, diabetes, thyroid and obesity specialist from Jabalpur, Madhya Pradesh. Today I would like to emphasize on the important part of the diabetes, that is high risk diabetic foot. As we know that diabetes complications are increasing day by day, but the diabetic foot complication is usually neglected, due to which there are increased number of amputations in India. So by simple examination and history of the diabetic patient, we can prevent these diabetic foot patients with amputation. So to initiate with, please take care of the inspection of the patient when he is coming to your clinic. Look for his gait, whether he is having proper gait or there is some deformity, which will tell you about his neuropathy. So the main problem of high risk diabetic foot is peripheral neuropathy. Either it may be due to peripheral vascular disease or altered biomechanics. Apart from it, there may be infections or associated medical conditions which leads to diabetic foot ulcers. So after seeing these high risk foot patients, we have to treat them properly to prevent the amputation. Whenever the new patient of diabetes is coming to your clinic, please inspect his feet for any skin changes, color changes, and whether there are any calluses, callosities or ulceration, and look for the deformities of the foot like claw toes or hammer toes or rocker bottom feet, which can lead to ulceration and ultimately gangrenous changes or amputation. So by simple inspection, you can prevent these diabetic foot complications. Then comes the part of the peripheral neuropathy detection to prevent the diabetic ulceration. By simple 10-gram monofilament test, by doing it at the major three parts, that is the great toe, first metatarsal, third metatarsal and fifth metatarsal, apply 10-gram pressure on these areas by monofilament, and you can detect the protective sensation is intact or not. For peripheral neuropathy, the other tests are vibration perception test, or by the help of biothiometer you can detect the peripheral neuropathy, or by the ankle reflexes. So by these simple measures you can detect early peripheral neuropathy and prevent the damage of the foot. Now comes the assessment of peripheral vascular disease, which is the more devastating thing because it will lead to ischemia and gangrenous changes. Any patient coming to your clinic, please look for peripheral pulses like dorsalis pedis or posterior tibial artery pulsation. And if you have some facilities of Doppler, you can go for ankle brachial index, that is the highest systolic blood pressure of the dorsalis pedis and the ratio of the highest systolic pressure of the brachial artery. If it is less than 0.9, it is the peripheral arterial disease is the risk. And if it is more than 1.3, the patient may have calcified vessels, which is leading to the falsely high level of ABI index. So by these three simple methods of inspection, palpation and some methods of the machinery, you can prevent the diabetic foot ulceration. So my message is that every diabetic foot ulceration can be prevented by the primary care physicians by only inspecting the feet, touching the feet, about the checking that whether it is cold or hot, and by seeing the pulsations or looking for any deformities, you can prevent the patient's ulceration and damage, further damage leading to amputation. So thank you for your patient hearing. Thank you.